Welcome to StantonMD. I'm board-certified emergency physician Dr. Ryan Stanton. In this episode, we want to dig deeper into eye safety, dental reconstruction, and the opioid abuse crisis. We will start with the story of Paul Gardner, who is battling to get his sight back after a wood-cutting accident. We spent several days with Paul and his surgeon, Dr. Thomas Stone, from Retina Associates of Kentucky, as he had surgery to help reattach his retina and then his follow-up to see how he is progressing. It's a long road and a great message for eye protection. After that, we will visit Justice Dentistry to talk with Dr. Tristan Thompson about dental reconstruction and the options for filling in the gaps in that smile. Finally, we have a special interview with Leigh and Rippetoe, who not only experienced opioid and heroin addiction, but lived to recover and tell the story. It's an incredible story that you won't want to miss. But first, let's visit with Retina Associates and find out about Paul Gardner. Paul's story plays out much like many that I've seen before in the emergency room. He was doing a job that he'd done countless times before, and out of convenience and complacency, did not put on any safety glasses.
I was cutting a piece of small trim quarter round and on a miter saw, and a piece chipped and flew up and hit me in the eye. I did not have my safety glasses on. I had gotten comfortable working without safety glasses, which was the wrong thing to do. Wear your safety glasses at all times.
The injury happened a number of months ago with a couple of surgeries prior. As Paul is about to go into the operating room, he tells us exactly what he can currently see out of that left eye.
No vision at all.
The operating room is a very busy place with machines and people all over. This room is made more busy with microscopes and fine instruments necessary to work on the fine structures of the eye. Imagine that your entire operating field is about the size of a grape, with stitches so fine that they are difficult to see even with magnification. As Paul entered the operating room, the first steps were to give him medication so that he would sleep through the procedure. Afterwards, the field was prepped and some injections were placed in Paul's left eye. After this, incredibly small ports were placed in his eye so they could access the inside with small lights and instruments. Then came the hard part. Dr. Stone and his fellow Dr. Leigh spent nearly an hour assessing the damage, removing scar tissue, getting the retina in its best position, and then reattaching it to the back of the eye. The retina is key. It's the part of the eye that allows us to see. And if it's not attached to the back of the eye, functional vision isn't possible. In this case, Paul's retina was detached and scarred into the shape of a cone with one firm attachment on the back. In the OR, it looked like a flower or a sea fan that was attached to the base, but the top was wrinkled and floating in the middle of the eye.
The retina was incredibly scarred down, and it was fully detached and was stuck to a lot of different parts of the eye, so I had to break up all those areas and then reattach the retina and flatten it back up and just flatten it.
So retina's reattached?
Retina's reattached. I have to do a few maneuvers to keep it there, but the hard part's done.
With overall success in the operating room, Paul was sent home to recover. Dr. Stone sat down to summarize the case.
Yeah, Mr. Gardner's case was complicated for a lot of reasons. One is that it was initiated by a severe injury to his eye, severe trauma, and that led to eye problems in the front of his eye and his cornea, which made the view difficult into the back. Of course, he had also had previous retina surgery elsewhere, and he had a very, very severe retinal detachment. We see cases like this probably about twice a year. It represents a small minority of even retinal detachment cases, so they're very challenging to fix. There's a lot of scar tissue buildup. The good news is during the case I was able to see what I needed to see, and I was able to successfully reattach the retina, so we're very happy about that. The thing that we find with cases like this is that it takes time. The eye is very sick initially when we get it, and the healing process is a process that can take weeks, months, sometimes even longer, into a year or two. But the first order of business is getting the retina back reattached, and I was very happy that we were able to do that.
About a month later, I called up to Paul Gardner during his follow-up appointment at Retina Associates of Kentucky. The lights of our camera were quite bright and his eyes are still very sensitive. Thus, he kept his eyes closed during the interview. Though he is making progress, he has a long road ahead. He told us about his eye on this particular day.
Some squiggly lights, the hand movement in front of my eye, and light. It'll take time.
The goal of Paul's vision is to get him where he can have what we call ambulatory vision out of that eye, where he may not be able to use it to read or drive, but that he sees something out of the side fairly well, that he can recognize shapes and things like that. You know, if you're driving, you want to be able to see something out to the side, or, you know, there's some safety issues with that. And just generally some usable vision that supplements his other eye, which sees much, much better. It's basically from here on out, assuming everything stays where it is, and so far so good, the plan would be to get some glasses or some lens or some focusing on that eye in some way. And sometimes we can do that with glasses. Sometimes that's a minor surgical procedure. And we basically just have to see how he does over time to determine what the next step is.
If Paul could go back to the day in his shop, things would be very different, because he knows now the risks associated with common and mundane activities. He also has a message for each of you that may be thinking about doing some work in the shop, at work, outdoors, or wherever it may be.
Wear your safety glasses at all times. Just be careful with your eyes. They're very important. Protect them at all times.
Eye trauma is a huge issue, and as you can see, the operating room is abuzz with work to help this man maintain and keep the best sight possible. I'm Dr. Ryan Stanton, and this is StantonMD. It's integral that anytime you're working with tools, whether outside or in the shop, you need to make sure that you use eye protection to protect that vision. More StantonMD right after this.
As a board-certified emergency physician, Dr. Stanton is a proud member of the American College of Emergency Physicians, also known as ACEP. ACEP provides physician and evidence-based patient resources at its consumer website, emergencycare4u.org. That site has stories, fact sheets, and advice on a wide range of emergency topics. From visiting the ER to mom tips, you can find them on emergencycare4u.org. Now, back to the show. With over 40 years of service, Retina Associates of Kentucky provides care for disorders of the retina, macula, and vitreous structures of the eye. Their goal is to provide the best possible care in a compassionate, personalized, and timely manner. This is accomplished through a comprehensive, state-of-the-art mix of diagnostics, medical, and surgical services. They have 10 offices throughout the Bluegrass. Visit retinaky.com.
Welcome back. Very few people feel like they have a perfect smile, and many will eventually have at least one gap in that smile. Whether it's from trauma or decay, the loss of teeth can have significant consequences to the function and face of your smile. We visited Justice Dental to talk with Dr. Tristan Thompson about some of the options for restoring that smile. Whether it's through trauma, decay, or just hard living, the loss of teeth can mean a lifetime of mouth challenges as well as significant aesthetic concerns. I sat down with Dr. Tristan Thompson to discuss options in dental reconstruction.
It's not uncommon that we have patients come in inquiring about teeth that maybe they've broken or have been missing, or they've just lost over a lifetime. One of the things that, or main words we mention, are dental implants. Dental implants are more or less a root replacement that are made out of titanium, and it is a great way to replace one tooth or multiple teeth. We can go across the entire gamut with those.
There are several options available when there is extensive disease. One of the best options is dental implants, a method to place teeth that may never have to be removed.
Many times people come in with periodontal disease or multiple missing teeth. You may even have a denture that you already have placed due to having those teeth gone. If you're missing multiple teeth, we can strategically place multiple implants, 4 to 5 implants sometimes, or as little as 2, and we can make that denture or multiple missing teeth be replaced. It doesn't necessarily always have to be a denture, but just for example, if you were wearing a denture for multiple years, which many people are, and you're not happy with the fit, you're not happy with your ability to eat, your ability to talk, you're not comfortable in social situations, we can go and place a couple implants, and that denture can then snap on those implants, or it can be screwed into those implants so where you don't even have to take something in and out of your mouth ever again. We do all these cases same day. Most often you come in, We work up your case. We make sure that, again, you're going to like the final result. It's very important that you know you're a part of this process. It's your smile, it's your teeth. You should be comfortable and happy with your end result. We can then place your implants that we plan on a 3D mechanism. It's called a CT machine or a CT scan. And we plan your case virtually. You come back, we place your implants, and you're off and running with something that snaps in or screws in, allows you to eat apples, allows you to talk and function as if you never lost any teeth.
These improved techniques are possible through incredible advancements in dental reconstructive care.
The technology in dental implants has improved so much over the last 5 to 10 years. We have state-of-the-art equipment here. It's called a CT machine. It's a 3D rendering of your bone and jaw. Once I have that rendering and I can see exactly where your bone mass is in certain areas of your jaw, I will then plan your surgery virtually. All your implants will be placed virtually on a computer. Off that rendering or off that planning, I can then order a stent. That stent allows me to place your implants perfectly with your restoration in mind. These surgeries have to be restoratively driven, meaning we have to know how you want your teeth to look, how we want these teeth to function in order to place those implants properly. It's a very crucial part to make sure the angles and to make sure the implants are placed at the proper depths. And using these CT-guided surgeries, we can ensure that to the nearest millimeter or 0.1 millimeter, which is really precise and a really cool thing we can offer.
To get an idea of how these technological advances work, Dr. Thompson talked about a recent case.
This patient presented to our office. She had upper and lower dentures that were not fitting. She was not happy with the aesthetics. She was not happy in social situations when she was out with friends or family and had the dentures moving up and down. So she came to us for her options. And the big thing with the lower denture is that you have your tongue. It's very difficult for a lower denture to stay in. So we presented her options of implants. In this case, she had the option of having 2 or 4 implants where the denture would snap on. A good analogy is that is like a ball and a hitch on a truck. It snaps onto the implants and doesn't move around much. But this patient did not want to have to remove the denture at all. So we planned to place 5 implants in the lower jaw and to have that denture totally screw in. It's called a dental hybrid denture, and so she never has to remove these teeth again. It will totally stay. How this surgery went was that we planned it, we made her a mock-up, she totally liked the aesthetics, and then we could guide the surgery 3D planned off that mock-up. We placed her implants, she'll heal for 6 to 8 weeks, she'll then come back and we will screw in her dental hybrid denture, which will look just like natural teeth. She will now be able to go out in social situations and be very comfortable. She'll be able to eat what she wants. She'll be able to eat apples, steak, things like that, and not have to worry about these dentures moving up and down. It really will change her entire quality of life, and that's something at Justice Dental we can offer. Not only the aesthetics and making you comfortable there, but just your overall quality. Being able to chew your food, be comfortable, and we're really excited about those type of cases.
Dr. Thompson has mentioned a couple of technologies that help them recreate that smile, so we took a tour of their office to see how some of these tools work. The first is a smile studio that helps patients see what they can expect in terms of how they'll look after the procedure, and then the CT scanner, which helps them make the plan.
This is something that we've just started doing recently. It's a smile studio, more or less, where we can take multiple images of your smile on video with you talking, you laughing, and then we can take those videos and we can plan your case virtually and show you what things could look like. It may be something that you're interested in with aesthetics. It may be one tooth. It could be a denture. It could be across the whole board. But it's hard for you to know what's available to you without actually seeing it or knowing. And with this studio, we can use certain lighting, certain recording devices to show you what could be available to you in your smile, in your dental health, and more or less in your comprehensive dental plan. This is a super cool technology that we can offer. Not many dental offices have a brand new CT machine. This machine is very low radiation compared to older machines, and what you would do is take a seat here, we would get you stable, and we would take an x-ray of your jaw. It would take about 4 seconds. This then goes to my computer at my office, and I can plan your surgeries, your personalized surgeries. Everybody's jaw is different. Everybody has different anatomy. It's very important that we know where those anatomical structures are before implants are placed. They need to be planned with a 3D machine like this so that things like your maxillary sinus or your mandibular nerves, or when we place your implants, we're as far away as possible. And those are things that are important to consider with implantology and dentistry.
There's an incredible amount of work involved in rebuilding a smile, but if you want a job done right, success is in the details and efforts from folks like Dr. Thompson. They do stress that there are multiple options available depending on budget and need. The important message is that you don't have to live with gaps in that smile. Not only will you benefit from the functional improvement, but you won't be afraid to show off those pearly whites in family photos. Dental health is more important than most people could even realize, and technology is advancing to keep a healthy and natural-looking smile. More StantonMD coming right up.
Do you own or work for a business that advances health and safety of the public or its employees? Then you may be interested in becoming a sponsor of StantonMD. There are various opportunities for sponsorship, from the show to the website, social media, print, or a combination. For more information on becoming part of StantonMD, contact Jen at info@StantonMD.com. That's info@StantonMD.com. Now, back to the show. Justice Dental provides world-class dentistry with a hand-picked team of doctors, hygienists, surgeons, and specialists that work together to create natural, beautiful, and healthy smiles. Realizing that oral health is key to overall health, Justice Dental provides everything from preventive dentistry to full mouth reconstruction, ensuring your smile will last a lifetime.
At Justice Dental, we want to do your smile justice.
Welcome back. Most of us are well aware of the opioid addiction crisis throughout the country, but especially right here in our region. Unlike many addiction epidemics in the past, this one is larger and is hitting a new and different population, one involving white, middle-class, suburban, and rural populations. Not to say this is all that are affected, but it's an epidemic unlike any that we've seen in modern American history. In many studies and work on this topic, I've found that one of my friends from my hometown in East Tennessee had not only been addicted, but has recovered and is now helping others recover from this addiction. I was able to sit down with Leigh and Rippetoe and part of her family to talk about her journey through opioid addiction and the road to recovery. Leigh Rippetoe grew up and currently lives in the quaint northeast Tennessee town of Johnson City, within the Tri-Cities. I lived there for 19 years myself through grade school, college at East Tennessee State University, and medical school. During my years in middle school and high school, I was friends with Leigh, but at some point, life took a different turn than most of us who grew up in the region. East Tennessee is about as American as it gets, with beautiful mountains, local eateries, a university, and revived Main Street. It's a region that prides itself on the love of God and the good old USA. It's a beautiful part of the country, but much like the rest of Appalachia and cities around the country, it hides a secret: prescription opioid abuse. The opioid abuse epidemic of the last 15 to 20 years has addicted millions and killed hundreds of thousands. It is a deadly spiral that often starts with a prescription from a doctor for a painful condition, but in time the person becomes addicted, and as more time passes, the needs and doses increase, eventually leading to more invasive administration and often a transition to heroin. With opioid legislation and an influx of cheap yet potent heroin, the transition is one of necessity and economics. Unfortunately, thousands each year will pay the price with their life. Leigh told me how her high school days at Science Hill High School included the usual classes and events, but weekends meant hanging out with friends, parties with alcohol and marijuana, but overall, it was a white picket fence, suburbia kind of life.
My parents are still married. They've been married for over 45 years. They both have great jobs. There are 4 kids in our family. My father had an airplane as I was growing up and put a swimming pool in our backyard, and we had horses, and we had things that I actually thought were normal for when you're young. Everybody has that. We were in a private Christian school. We were in private Christian school until my twin sister and I were in 3rd grade. So our lifestyle, or to look at us from the outside, everyone thought we had the perfect upbringing, the perfect lifestyle.
It wasn't until she was prescribed Percocet for persistent migraines that her downward spiral began.
Yes, it was a Percocet prescription intended just to treat headaches as needed, and I think the prescription, and I guess it may be weird that I know this, but it was supposed to be taken 1 every 6 hours as needed, and that prescription should have lasted me a week, if not longer, and it lasted me 2 days. And because after the first pill, I realized I had a worse headache, but I didn't feel I didn't need to worry about the headache. It was the headache was the least of my issues at that point. I could almost become anybody on that medicine. So the doctor's visit wasn't fishing. I didn't go fishing for narcotics. I went legitimately with an issue, and the doctor wrote that prescription legitimately thinking I was going to take it how it was designed to take, and that just didn't happen. So that 1 pill bottle and that 1 prescription stayed in my pocket for a matter of 2 days before it was empty. It spun out of control so quickly I could never get a hold of it. Disease of addiction is so cunning and baffling that it comes at you in every form, wrapped up in the best packages, and it almost sneaks in when you least expect it.
As her addiction grew and grew, Leanne faced the challenges of a growing dependence and increasing need for drugs. She became desperate. She began using her nursing license and job to fill prescriptions at pharmacies around the city. She told me that she would clean up, dress as nice as possible, and go into those pharmacies with falsified prescriptions in order to get what she needed. But eventually the law caught up. She remembered hearing rumors that the police were looking for her, but she never truly believed it until the police knocked on her door.
All of my criminal charges spurred from me filling prescriptions that were not in my name, or were not to me, and filling prescriptions fraudulently. And along with those fraudulent charges came tacked on accessory, conspiracy, forgery, identity theft, criminal simulation, criminal impersonation. Those were things that went along with filling a fraudulent prescription.
She also notes that jail is not the answer to the addiction crisis.
There was nothing about jail that taught me anything other than that I didn't want to go back there, and how to become a better criminal, how to hide things better, how not to go back, and not how to get clean.
As her addiction spun further and further out of control, Leanne recalls that her role as parent flipped.
When you're a mom and your child gets sick, you rub your child's back if they're getting sick, physically sick. You're in there. You're there and you're present, and you are that one who rubs their back and gets that washcloth and talks them through that and helps them through that and gets them back in bed and watches them. So I was the mom that ultimately turned into the child. I'm the one who was sick daily, throwing up from being so high, where my 3-year-old came to me and rubbed my back and talked me through being sick.
Her oldest child, Maddie, started feeling this change as well.
I remember always being the mom figure normally for my brothers. In a good way, I was always there for them, but I had to take the memory away from it. So I would do it again just to take care of them so they would never have to remember what went on during their childhood. But it kind of haunts, I guess, my childhood.
Later, she started noticing that something weird was going on.
It was some of my stuff would get sold for money. Like I had this favorite puppy, and his name was Duke, and he got sold for money. It was just when I got older, I was able to catch on to all the little things that they didn't think were obvious because they weren't in the right mindset, but to me, they were obvious. And especially when my grandparents were always over at our house trying to check on us or something. I mean, they knew we weren't in a good environment, so they were trying to change that.
Eventually, after arrested, losing her home, her children, and about everything she had, she reached rock bottom. At the urging of her father, she looked for help, but in reality, she didn't feel ready.
I was not prepared to hear those words, and I honestly was prepared for a 4 to 6 week waiting period. So the words, I have a bed and you have 20 minutes, and just were like a punch in the gut for me.
As Leanne recovered, she found that one of the gifts of her addiction and subsequent recovery is that she can help others navigate the same path. She talks about the challenge of sobriety. She also has a message for others who are fighting addiction.
The obstacles that are placed in front of you, day one, going back to just for today, there's still a possibility to recover. Recovery is possible. Placing the right things and the right people in your path is very crucial to recovery. Maybe a message is get clean whichever way works for you, because recovery will work as long as you work the program.
There's two things I hope that you can get from Leanne's story. One is hope. If you have a family member or you yourself have an addiction issue, there is hope out there. There's help out there. You need to seek it. Accept that you have a problem and get the help you need. Recovery is not a quick process. It's a daily commitment to being better and making the right choices from today on. As Leanne says, today is your first day of recovery. And second, understanding that the addictions we're seeing now aren't the same addictions we used to see. These aren't the inner city addictions that we see in homeless folks that we've allowed to sweep under the rugs for generations. These are among our friends, our family members, those within our church, our friendship circles, through our schools, through our employment. People we know and work with are suffering from these addictions. So we need to understand that they're out there, realize that this is a fact, and do what we can to get folks out of the grips of addiction. I'm Dr. Ryan Stanton for StantonMD. This is actually just excerpts from the full interview with Leanne. The full discussion includes over an hour in content that we'll make available on StantonMD for you to watch and share as well. The more we understand this crisis, the better prepared we will be to help people recover. That's all the time we have for this episode of StantonMD. Please visit the StantonMD website for episodes and more information about the show and our sponsors. Also, like us on Facebook for more information and content. Learn more about our sponsors as well. Also, if your business has technology or a practice that promotes health and safety and you want to be featured on StantonMD, contact us at info@StantonMD.com. That's info@StantonMD.com. Until next time, I'm Dr. Ryan Stanton, and this has been StantonMD.